Hi, I'm Dr. Michele Shermak. I'm a plastic surgeon, and if there's one thing I know a lot about, it is arm contouring. This is a topic that I talk about a lot on the national and international stage, and I want to kind of work my way up as far as talking to you about tools that we have to create great arm contours. And we're going to start kind of at the lowest, less invasive level, which is Emsculpt Neo. And boy, am I loving this machine. It's a technology that combines radio frequency, which helps melt fat, with electromagnetic energy that builds muscle. And this is a great tool to apply to either the bicep and or tricep area to help reduce fatty tissue, help build the muscle. And although we don't like to overpromise this, it does create some skin tightening and pull up of the arm. This is just a wonderful treatment that's very impactful, non-invasive, takes 30 minutes per session, and usually takes about 4 sessions spaced about a week apart. There's no downtime. Our patients come in and they leave within 45 minutes fully treated in this one area that they decide to treat. So that's kind of our first rung of our ladder, the minimally invasive Emsculpt Neo. The next rung, I would say, would be our mini arm lift. What this is a little excision of skin in the upper arm just outside of the underarm area that helps provide some pull and helps reduce some of the sagging of the arm skin. We see this in people who have more lax skin, maybe a little crepiness, and they just don't like how it looks in sleeveless clothes or during athletics. This can be done under local anesthesia and only takes about 45 minutes, but I'd say it's also a nice little procedure to add on to a more surgical procedure that would take general anesthesia. The scar is highly acceptable, and we do see some great results with this technique. It can actually be performed serially, so every 6 months people could come in and do it, and it just helps kind of inch that skin up more and more. What it doesn't do is it does not reduce the circumference of the arm. It doesn't really tighten the tube of the arm as much as just kind of pulls on some of the laxity of that skin. So that's number 2, is the minimally invasive arm lift. Kind of working our way in, I'm going to inject liposuction there. And arm liposuction is a very powerful tool being performed through very minimal incisions. And even in patients who have some stretch marks to the arm, who might have a little bit of skin laxity, I've seen like some amazing results come through with just liposuction. The beauty of this procedure is the impact of it. I typically do it under general anesthesia, and just doing arm liposuction shouldn't take more than an hour. It can certainly be tacked on to other procedures. With this procedure, I do like to use some compression post-operatively to help better shape the arm and reduce some of the swelling in the area. But I'd say you could certainly just like toss that garment off to the side if you want to go out, and you can do that really quickly after this operation. I'd say certainly within 7 days you should be able to go out and be seen, and it's awesome. The next rung, I'm going to kind of come back to excisional techniques, and that would be our arm lift procedure. So this typically involves an incision from the elbow to the underarm, and often extending even along the side of the chest just to get a pretty L contour and really open up that area of the underarm. We get skin tightening, so you do get some reduction in the kind of tube of the arm, a reduction of the circumference. You get a reduction of laxity of skin. The skin looks better. The patients look amazing. And really the placement of the scar for me is very strategic, in that when you hold your arms down, the arm scar should not be visible. When you hold your arms up, it could be visible, but who walks around like that most of the time? We work on the scars very intensively after 6 weeks, and can get really great scar outcomes over time. Working our way up from just the arm lift, I would say we're working our way into an upper body lift. So this surgery involves an incision from the elbow to the underarm along the side of the chest, and this will extend into the chest area. In men, we can perform gynecomastia procedures, reducing extra skin that we often see with maybe significant weight loss, and work into that. In women, we can work into a breast lift, a breast reduction, or a breast lift and an augmentation. And that just works very nicely into the sweep of the breast to get a whole region done in the body. We also secondarily get some improvement in the upper back skin excess. So that's like an extra win. I would say the other thing that we can accomplish might be a little south of the breast, which would be the upper abdomen. Through the chest crease there, we can actually lift any laxity in the upper abdomen. This is called reverse abdominoplasty, kind of like a gymnastics type of move. We can actually get upper abdominal skin tightening and a really nice improvement, particularly in women, of the breast crease and a nice really tight crease. This is arm contouring from A to Z. We're starting with our M-Sculpt Neo. We work up to our mini brachioplasty, our mini arm lift. We're injecting liposuction into the mix there to get some really great contours, moving into a full arm lift, and finally moving all the way into an upper body lift. I would say that it really depends on people's presentation, their goals, their expectations, and their acceptance of scars that might be associated. But I say any of these choices really provide impactful results. Anyway, arm contouring is an amazing topic. We've seen some incredible results along a broad range of presentations and a broad range of procedures. Who wants to go to someone who can offer you one procedure? We have a full range of procedures to tailor to each patient. I hope this helps. Next steps would be to check out our website, Dr. Shermak, SHERMAK.com. You can check me out on social. You can also just give us an old school call, 410-616-3000, and set up a time to come in and be seen. See what works best for you.